Well, good afternoon, everyone. Welcome, and thank you so much for joining us for this special Coffee and Quality virtual session that's featuring the process and the findings from our case study with HAAM, also known as Humble Area Assistance Ministries Social Services. We are so excited to feature them, the work that they're doing, and how they're using data to help improve and inform their efforts. Wonderful to see you all. If you haven't met before, my name is Jessica Davison. Nice to see you. Please share in the chat your name, where you're joining in from. Would love to start that moving as we move forward. So if you've been to Coffee and Quality before, welcome back. If you have not, if this is your first time, welcome. So glad you found us. So in Coffee and Quality, in this virtual space, we really like it to be a space where anyone can come to it and absorb these findings, absorb this information, and take it back into their organization. And so we've got a couple of ground rules here for you. And so our first ground rule is this is a safe place to share and learn. We're all in different spaces, literally, with our organization, with our data. Virtually, we're in different spaces. And so it's a safe place to share and learn. And so want to encourage folks to use the chat to ask questions. Feel free to use the raise hand feature if that feels good to you as well, or just come off mute and share aloud. Would love to hear your voice. In these Coffee and Quality spaces, when we're sharing different content, different items, there's sometimes things that you hear and you're like, yes, wholeheartedly, I agree with that. There are other times you hear things and you're like, oh, okay, that's maybe different than what I think or what I believe. And so, or what I've experienced, which leads back to like, it's a safe place to share and learn. So please have an open mind and heart as you're kind of hearing the different findings, the process, whatever you're hearing today. Just continue to have that open mind and heart. Share your knowledge and experience. That's the chat, that's raise hand feature. Would love to have that from you. And then as always, it's an invitation, not an obligation to participate, but really hope you can absorb the info and take it back to your organization. So as we keep moving forward, we do have this quarterly session. We have a big old library full of quarterly sessions, past recordings that you can dive into. But we also have a Teams channel that you can join where you can get access to more resources. We kind of share different trainings, workshops, articles, whatever it might be on our Teams channel. And so if you want to be in that Teams channel, just put your email in the chat and we will add you to that Teams environment after this. It's a great place to kind of just get some resources and knowledge outside of these quarterly sessions and our Coffee and Quality offerings. So with that, very excited to spotlight today our case study that we did with HAAM Social Services. And so for those of you who haven't heard of the case study before, the case study is where we take one nonprofit organization and for a 6 months experience, we really dig into their data and help them answer questions that they wouldn't normally be able to answer by way of support from Kinder Institute for Urban Research. And so joining me today from that team, you have Daniel Potter, who's right here in my office. And you also have Sejal Gupta from the team there, as well as Shaylee from Kinder as well. So thank you all so much for their support in this case study. But the spotlight really was on HAAM Social Services and the incredible work that they do. And so the case study starts off where we have a kickoff session with them, really understanding what their data practices look like, what questions they're trying to answer with their data, their mission, really focusing in on what their impact looks like and how the data they have can help them answer some questions that they're trying to have answered. And so today is the presentation on the process and the findings from that, as well as lessons learned and takeaways for their organization and with things that you can consider for your nonprofit. And so getting a lot of that you can take back into your organization. So that's the case study. And so without further ado, I'm going to hand it over to the team from Humble Area Assistance Ministries to share more about their organization.
Thank you, Jessica. My name is Tiffany Stafford, and I am HAAM's Chief Development and Strategy Officer. So I kind of have a dual role. I do oversee the agency's fundraising efforts, but since I've spent my entire career on both the fundraising and program sides, I also have to spend some time there to keep myself engaged in the work. So I work a lot on the agency's partnerships, as well as making sure We have connected the dots in terms of our programs and our funding and our partnerships. Before I dive into the background of who HAAM is, I just want to thank Jessica, of course, with United Way, who is, I mean, just an amazing partner, but also Daniel and the team from Kinder. This has been an amazing process. It has been meaningful time spent. We are super excited about today, but also just about moving forward with the data that we have. So thank you all so much, and thank you all for being here today. So a little bit about HAAM. The agency was founded in 1990, so we are celebrating our 35th anniversary this year. It's kind of strange to use the word celebrating. Maybe commemorating is a better word to use. But 35 years of providing comprehensive social services in this area. On your screen, you'll see our mission and vision statements. So we're an interfaith social service organization that connects individuals and families to community resources. We build stronger futures by inspiring hope. And our vision is building our community where individuals and families have opportunities to thrive. So our service area is primarily in Northeast Harris County and East Montgomery counties. So for those of you, our main social service office is in Humble, Texas. For those of you who do not know where that is, because Houston is so large, we are just straight up 59 North. So if you think 45 North Woodlands, HAAM is 59 North in Humble, and we serve the city of Humble. We serve Kingwood, Atascocita, Porter, New Caney, Splendora, Huffman, and Crosby. So it's 13 zip code areas in Northeast Montgomery County and Montgomery County, Northeast Harris County and East Montgomery County. I'm sorry. So what you're seeing now are our 7 programs. This is how we kind of structure our services. And I will say before I tell you a little bit more about each one of these, we are constantly thinking about, you know, if these really work for our clients. And so certainly with this study, we've had opportunities to think about if we want to make any changes to these, do they still make sense? So our basic needs program includes our food pantry. HAAM was founded primarily as a food pantry. So it includes food assistance as well as rental assistance and utility assistance. We also provide assistance with prescription medications and IDs, like government issued IDs. Our employment and education programs really work hand in hand. And I would say this is one of the areas where we're thinking about if it makes sense for us to combine the 2 programs and find an appropriate name for that combination. But this is where we're helping people to find employment or find better employment, and of course, help them access the education or training they may need in order to secure that employment. Family services is essentially made up of our mental health initiative. So we have a licensed mental health counselor on staff who provides individual and group counseling and coaching. Our support services includes really our case management structure, but also some of our I kind of call them outreach programs for lack of a better term, but it's things like our back to school program, where we're providing food and partnering with the school districts to offer school supplies, or it could be our Seasons of Sharing program that happens during Thanksgiving and the other holidays to make sure people have the supports they need during that time. Disaster relief and recovery, we obviously, it's regular work, right? It used to be that a disaster would happen, we would respond to it, and then kind of move on from it until the next thing happened. But more and more, disaster relief and recovery is becoming year-round work for us and for most agencies in the Houston region. So certainly involved in that. And then our senior services program, which has three primary components. There's a case management component that is specific to the needs of seniors. We have a very robust Meals on Wheels program. That's kind of the second component. So I think we have about 11 routes now that we're operating. And then the third component, which is super exciting, is digital literacy. And so we're providing education and literacy tools to our seniors as they navigate technology. There's so many considerations where we're all concerned, but certainly our senior community. So that is us in a nutshell. We distribute more than 700,000 units of service annually to about between 9 and 10,000 people. And the 10,000 is really our heads of household, the people that present themselves to our agency. If we include their household members, because of course, most of the programs and services are impacting everybody in the household, then we're looking at closer to about 30,000 people annually. So that is us in a nutshell. I will, unless I left anything out, Kristen, I will turn it over to Dan and the Kinder team.
Excellent. Thank you so much for that. And I want to also start with an acknowledgement of appreciation again for Jessica for this opportunity for us to continue to be working on these case studies, connecting with nonprofits, and then also an appreciation for HAAM, that connecting with you all and learning about the programming, learning about your data, and then just the ongoing conversations, coordinating, cooperation as we were learning together through this process. These case studies only work with that in mind. And so very, very much appreciative for the opportunity and very excited to be here to share out today what we have been learning. So real quick, in terms of the presentation we have here for Kinder, we're going to talk through some of the goals of our case study. We're going to go over the process. Jessica shared a little bit about that already. We'll just go through that one more time. Then we'll outline the research questions that we identified as part of this case study, talk through a little bit of the plans for analysis, and then let's get into the meat and bones of this. What did we actually find? What were we learning? And then moving out of that into, okay, so what do we do with that? This is not information for information's sake. This is information for action. And so let's get going. So our goals for this case study, and this is sort of a hybrid between goals that are unique to HAAM, but also goals more broadly for all of the case studies that we're doing here. And so working with HAAM, we were working to connect data that they have about those individuals and the households that they are serving with those services that they are providing in order to unpack a couple questions. One of them focused on the who they are working with and who they are providing services to. And then the second one, recognizing this new initiative that HAAM has gotten underway, looking to connect their clients, looking to connect households beyond those basic services. So they've got folks that might be coming in. Are we moving them out of those basic services, basic need services, over into some of those longer term programming? And so that's what was guiding a lot of the work specifically with HAAM, more broadly recognizing the goals of these case studies about developing and then ultimately sharing out insights that we're learning through this process to the broader, wider nonprofit community, making sure that we're looking for those takeaways that are not, yes, specific to HAAM, but then also we can all be learning from those. Our process in order to achieve those goals really starts out in this space of that co-creation, that co-development of this research project. Jessica shared out about that kickoff meeting that we had, us coming together, talking, learning, listening, coordinating over tamales. Of course, we gotta give credit where credit is due. Delicious tamales. But that is about coming together and that shared knowledge and being able to hear and understand one another and what we were after. There's a little bit of some of that data sharing and agreements that takes place in the background, but part of that is how do we move these data in a responsible and secure way? And then begin to look at that to make sure some of those early ideas, do we have the data and information needed to be able to answer some of those questions? Once we've got a good grasp of that, we're making sure that we're refining the research plan and making sure that we're sharing that, coordinating that with HAAM. Again, part of this is this ongoing communicative process where we're talking with United Way, talking with Jessica, talking with Kristen, talking with Tiffany and HAAM to make sure we're all on the same page with this. This is this partnership model that we're after. Once we're in agreement, we're getting those data, beginning to process them, analyze them. That analysis, though, is not done in silo. It is, again, this ongoing conversations, ongoing communication, sharing out preliminary results, getting feedback on that, helping to guide corrections, adjustments, new ideas, all of it in the spirit of making sure that whatever it is we are producing, it is accurate, it is reflective of what is going on, and it's actionable at the end of the day. And so that's that cycle of result sharing, partner input, revising, arriving at that final moment, final set of analyses and results. And that's what we're here to share with you all today, disseminating out this result. Again, this is not information for information's sake, but rather getting that information shared more broadly. So the goals, this process produced for us 2 research questions. Our first research question: what are the sociodemographic characteristics of clients that HAAM has been serving between 2018 and 2025, looking to see if their clients have shifted over time. And then our second research question: to what extent do HAAM clients progress from that receipt of short-term basic needs services into some of that longer-term programming? In order to help me talk through our results from these, we're going to first start focusing on the research question. And for that, I want to hand it over to my colleague, Sejal.
Thank you, Dan. So yes, as Dan mentioned, HAAM was really interested in learning more about the clients that they serve and how that's been changing over time. Examining the socio-demographic characteristics of their clients and comparing that with the makeup of the overall service area can help them identify whether the clients are being underserved or have been less frequently served over time. And so to do that, we took a descriptive approach. We examined HAAM's clients, so each unique individual receiving a service, as well as the number of services that HAAM had delivered. We evaluated the distribution of client age, as well as a couple of demographic characteristics, such as education level, race and ethnicity, and employment status for the clients that are over 18. So to help frame the following slides, we've pictured HAAM's clients and services provided over time here. On the left, this graph is showing us an annual snapshot of the number of clients that HAAM has served every year. And on the right, we see the same thing, but with the number of services provided every year. And so as you can see on the right, there was a decline in the number of services provided from 2018 and 2019 to 2020 and beyond. And this reflected an intentional choice by HAAM to alter their service delivery plan. And we kept these trends in mind as we conducted our analysis over time. And then I'd like to point out, on that last side, I'd like to point out that it's interesting to break down our analysis in both of these different ways by both the number of clients and the number of services, because you can answer different questions. If you want to focus on the number of people that your service is reaching, you would look at the number of clients. If you want to focus on the number of services that are going to a target demographic, you would focus on the number of services. And so on the next slide, first, we're going to focus on age. And here we see a snapshot of the age of every client that HAAM has served over the past 7 years. As you can see, the most common type of client served were those that are 18 and under, as shown by the first peak in the graph here. And then we can also see that HAAM served many clients in their midlife, so between 35 and 45, as you can see by that second smaller peak. Here, we made the same chart, but instead of just focusing on the clients, we're now focusing on the services and the age of the client to which that service was provided to. So from the last slide, we know that many of HAAM's clients are 18 and younger, and here we can see that many of HAAM's services are going to those who are 18 and younger, which makes sense. However, we also see spikes around 65 and 80, which show us that a high proportion of HAAM services are going to the elderly. We were able to learn that while HAAM doesn't have as many elderly clients as they do younger or midlife clients, the organization's elderly clients are receiving a higher number of services per person than the other age groups. And this slide is the same information, but we broke it down by year. So unique clients are on the left, services are on the right. And so the proportion of HAM's younger clients, which is that dark blue bar, is growing, as well as the number of services that are going to that younger population. And then again, you can see with the older population, which is that light blue bar, they're receiving a larger number of share or a larger share of services relative to their share of the overall client population. So in other words, while the number of elderly individuals that HAM serves is relatively low, the number of services going to those individuals is relatively high. And so now we're going to move on from talking about age to talking about demographics, starting with education level. And so this graph and the following graphs that we're going to discuss are going to focus on adult clients specifically, so those 18 and older. This graph here, shows HAM's clients broken down by year and by education level. So as you can see, in 2018, HAM was serving a lot more clients without a high school diploma than they were serving clients who had a high school diploma or who had education beyond high school. And then over time, these lines are starting to come together. These numbers are starting to converge. And now that we can see that today, HAM is serving an equal number of clients across these three education levels. We ran the same analysis, but this time focusing on race and ethnicity. We modeled 5 ethnic groups, so Hispanic and Latino individuals, Black individuals, white individuals, and Asian individuals, along with those considered part of the other category or those with race and ethnicity unknown. And as you can see, over time, HAM has continued to predominantly serve Black and Hispanic individuals in the UMBL service area, and for the most part, the proportion of the different races that were served have remained stable over time. We can see in the early years there was a slight decrease in the proportion of Hispanic individuals served and a slight increase in the proportion of Black individuals served, but these changes also evened out after 2021. And then again, we ran the same analysis. This time we were focusing on employment. So we looked at those who are unemployed, those who are employed, and those who are not in the labor force. And over time, these proportions remained constant, with the majority of HAM's clients being those who are unemployed. And so now that we've gone through all of these various in-depth findings, we come back to the question, how has the makeup of HAM's clients changed? So to run through it again, we saw a growth in clients under 18 in both number of proportion of services that are going to these younger clients. But even with that growth, we've seen that HAM has still dedicated a large proportion of their services to the elderly population. And then when discussing both employment status and ethnicity, the makeup of HAM's clients has remained relatively stable, with the organization predominantly serving Hispanic and Black clients in the UMBL area, and as well as clients who are unemployed. This makeup, however, it did change by education level, with a lower proportion of clients having less than a high school diploma today than compared to HAM's clients in 2018. Having insight into all of these different changing trends means that HAM now has a new picture of who their services are going to and how that may influence who they may want to target their outreach to. And so now that we've gone over HAM's clients, where I'm going to pass it over to Dan to talk about HAM's services with the second research question.
So thank you so much for that, Sejal. So for our second research question, and again, we've been provided with this overview of the clients that HAM has been working with. So we wanted to now look at some of the services and how those are being administered. And again, being driven by and guided by this overall question about moving clients from receiving basic needs into some longer term programming. We're going to look at that to understand what proportion of clients are sticking in that basic needs only versus moving from basic needs to longer term. We're going to look at who those different clients are belonging to those groups. And then finally, we're going to start to talk about what are some of the most common program areas as well as services that these two different groups of HAM clients are receiving. And so the analysis plan for this, similar to what we did for the first research question, we're going to apply some descriptive analyses. But for this one, we're going to be focusing really on a subset of HAM's clients and data. Particularly what we're going to do is we're going to start with that full data set we were working with previously, and we're going to narrow it down to focus on clients who are 18 to 59, clients who do not have a disability, and clients who are services that are not designated senior services. And the reason for this is, again, sort of recognizing this initiative, this focus on the part of HAAM being driven by wanting to move particular types of clients, particular types of individuals into some of that longer term programming to move them towards independence, whereas for other clients, not necessarily having that same initiative, wanting to make sure there's that long-term support needs necessary for older adults and adults with disabilities. We're going to calculate and compare some percentages of clients over time. And again, looking at this shift from basic needs into longer term programming. For this subset, we ended up focusing on a total of 10,070 unique households. Those households included 19,130 unique individuals between the ages of 18 and 59. These individuals received about 166,000 services. We see the breakdown of the program areas here, where those services were located. Our most common program area for those services, basic needs. Again, this is where a lot of clients are starting. But we also see a lot of needs in that supportive services, the financial stability, disaster services, and family services. I want to take a second to call out the assessment services here. And this is where one of the things HAAM's doing is when they're working with clients, they want to understand what opportunities and maybe the levels of readiness that a client might have. So there's assessments and screenings that are being done. And these are important for connecting clients into those longer term programming, but also may not necessarily represent additional services or supports in a way that, again, if we're thinking about supportive services, financial stability might play a role. And so when we're thinking about this movement from basic needs into longer term programming, we're actually going to combine basic needs and assessment services and kind of think about them similarly. And really, when we're talking about longer term, we're talking about disaster services, we're talking about family services, financial stability, and supportive services. Just sort of outlining that here first. All right, so what did we find? Sorry, one more slide, and then we'll get into what we found. So when we looked at these clients, and again, we're talking about the 19,000 unique individuals, 166,000 total services. These are the top 10 most common services that we were seeing from them. And we see basic needs there at the top. And a particular service was food pantry grocery distribution, where we see that coming in with over 63,000 different services being offered in that. We can see the other ones, the different program areas. Both the assessment services show up here. We see supportive services. We also see other basic needs services, such as clothing vouchers, prepared meals pickup. We also see additional supportive services around case management, as well as holiday toy programs. And so these are the top 10 services. We're going to revisit this question for each of the groups that we're going to talk about here next, but wanted to start with sort of an overarching view of what services that these clients were receiving. All right, so what did we find? Well, let's start with, we actually ended up finding 3 groups. Up to this point, we've been talking about 2 groups we were going to be looking for. Those folks that start in basic needs, and that's sort of as far as they progress in their journey with HAAM. But then we were going to look for that second group of folks that start in basic needs and transition into that longer term programming. Well, we were in fact able to identify a third group in the data, which are those who start with the longer term programming. So they're coming in to that financial stability. They're coming in to those family services. Now, these folks might have ultimately gotten other services, basic needs, or additional longer-term programming, but because they were starting in that longer-term space, we wanted to go ahead and create that third group so that we're calling attention to what that's looking like when we're looking across time with HAAM. And so those are going to be the 3 groups that we're going to look at as we progress through the rest of the slides here. So what's the breakdown of these groups among the clients that we were looking at? Well, we can start by looking at this by households. And so we've got group 1, again, group 1, start with basic needs. They stay with basic needs. Group 2, starting that basic needs, making that transition over. Group 3, starting in those other longer term services and other services being provided from there. Group 1, over 4,000 households find themselves in group 1. So that's going to be your starting in basic needs, and sort of that's where you're sticking in basic needs. When we look at group 2, that group that's moving from basic needs into that longer term service, we see almost 4,500 households making up that group. And then finally, for group 3, those folks starting in those longer term services, almost 1,600 households belonging there. We can also look at this information broken down by unique individuals. It tells a similar story, but again, kind of wanting to confirm, do we see something similar there? And so indeed, we see with group 1, 7,400 unique individuals belonging there. Group 2, 9,100 individuals. Group 3, almost 2,600 unique individuals. So we've got a pretty healthy makeup in each of these groups. So let's try to unpack, who are these groups? Are there particular characteristics that might lend themselves to being a member of group 1, 2, or 3? And our punchline to that question is no. What we found regularly was that if you look at the education level, if you look at the employment status of these individuals, there really isn't a distinguishing feature that says, oh, this type of group is more likely to be a group 1 or a group 2. One thing that maybe is a little bit of a difference is with group 3, we did have a slightly higher percent of clients missing education data. And so that's that kind of dark green section of the bar there, 24%. But if you look kind of across the other groupings, it follows very closely in sort of a proportional way with the other groups. And again, and when we go over to the employment space, it's even sort of more reinforced that there's not a particular type of client that makes one group or the other. All different types of clients are finding their way into these different groupings. And so let's look at the program areas and services that these different groups of clients are receiving. So for group 1, and again, because these folks were sort of starting in basic needs and that's where they were staying for their journey with HAAM, when we think about the program areas, there's really going to only be 2 that they belong to, and that's going to be your basic needs program area, as well as that assessment services program area. When we're looking at the top 10 most common services that this group 1 clients were receiving, number 1, food pantry grocery distribution. 2, utility assistance, specifically for electricity. 3 would be that screening. 4, rental payment assistance. And again, these are those basic needs that people are coming to HAAM. HAAM is supporting people with. And so we're seeing that support there for this group. Moving to group 2, and this is again that group starting in basic needs and transitioning into that longer term services, we see the number 1 program area, the program area with the most services being rendered for this group is still basic needs. And so perhaps not surprising, and they're starting there, but we also see a very healthy number of services being offered in that supportive services space. We see those assessments taking place, and part of that is that screener. What is the other service to connect folks into? We'll also see in disaster services as well as financial stability services relatively well represented here. When we look at the specific types of services folks are receiving, the number 1 most common service is, again, that food pantry grocery distribution service. They're at number 1, and the other ones fall out from there. And again, sort of a combination of supportive services, assessment services, basic needs make up the 10 most common services that folks are receiving with their engagement here with HAAM. And then finally, for our third group, and again, this is kind of a different group. They're starting out in that longer term services space. And so what we see from this group is that the most common program area that they were receiving services was supportive services. And so that's a little bit different than the first 2 that we had observed. However, when we go and we look more specifically at the unique top 10 most common services, here we see a little bit of a similarity with what we have seen before, where our most common service would be that food pantry grocery distribution, but we also see a lot of supportive services, disaster services, even financial stability, cracking that top 10 in terms of the services that these folks are receiving. And so then a final question here is, this is an initiative that HAAM has implemented, they're working on. And so what does this look like over time, these different groups? And so we wanted to unpack that. And so we looked at this both for households as well as for unique clients. We're going to start with the households here. And so when we're looking at this, the thing to take note of is that dark blue bar at the bottom here is representing the proportion of households that start with HAAM receiving basic needs services, and they're staying with HAAM for basic needs services. And what you can see moving from 2018 to 2024 is a pretty steady drop in the percent of those households. And so going from 40% back in 2018 to now 27% with 2024. So if we're thinking about HAM looking to move people from that just basic need services to basic needs to longer term programming, this is suggesting they are having fewer and fewer clients that are staying in basic needs only. Well, so where is this balance, right? And so for that, let's look at the top of the bar now. That's going to be our light blue. So for this light blue, this is actually group 3.
Mhm.
So these are the folks that are coming into HAM in the long-term care, long-term programming, and then perhaps moving into other spaces. We see this has tripled since 2018. 6% in this case, we're looking at households. 6% of households back in 2018 were coming into that longer-term programming first. We see that has grown to 19% more recently in 2024. And so then this leaves the balance, which is our green section of the middle section of the stacked bar chart here. These are the folks moving from basic needs over into that longer term programming. And this percent has remained relatively constant across this time. And so they're moving folks out of that space of just basic need services. And seemingly, perhaps the way that's happening is by moving them in directly into longer term programming from the get-go.
Mhm.
And so this is looking at households. We can look at this again by individuals, those unique clients, and we see that again. That dark blue bar sort of decreasing steadily over time.
Mhm.
Again, making sure that those clients are coming in, we're wrapping them around with additional services. That light blue bar growing a little bit over time so that we're engaging them directly in some of that longer term programming. That green bar remaining a little bit static over time, but again, representing that the majority of the clients that are coming into HAM, they're moving from those basic needs over into that longer term programming. And so reflecting the goals of that initiative. We had a lot of data here.
Yeah.
We had a lot of data. So we can summarize this real fast here. So to reflect again on the results that Sejal shared out for research question number 1, when we're looking at the clients from 2018 to 2025 and thinking about the sociodemographic makeup of them, we saw that race and ethnicity remained relatively stable as HAM continues to be a service organization supporting Hispanic and Black residents. We did note a bit of a change in the education level. We saw that lowering of the proportion, convergence of education levels, if you will, over time. And then we also saw a reduction in age a little bit, a higher proportion of the clients that HAM is serving being under 18. These changes in makeup now, even as sort of they got younger, they didn't really change the emphasis and the focus of HAM per se, in sense of that, like making sure that they're putting those services towards older adults. And so we still see that higher proportion, the largest proportion of services being directed at older adults. And then in terms of our second research question, this movement of clients from basic needs into other longer term programming services, we see that back in 2018, 40% of clients, households were starting there in basic needs, and that's where they were sort of staying. And that has shrunk all the way down to 27% here in 2024. And really where that seems to be, the action seems to be happening is by getting clients plugged in immediately into that longer term programming that HAM has to offer. And so these are our results and our findings. And I want to toss it over to Kristen to start talking about, well, what are we going to do? What are our takeaways perhaps here?
Okay. Thanks, Dan. Good afternoon. My name is Kristen Wallace, and I serve as the financial administrator at HAM Social Services, where one of my roles and responsibilities is to oversee our database administration and reporting. I also want to extend my thanks to United Way and the Kinder team for this invaluable opportunity to gain greater insight into the clients who we serve and to see how we are measuring against what our mission is. Like many other mid-size agencies, our data team is limited. There are 2 staff, and both of us have additional responsibilities. So having these dedicated and brilliant minds at Kinder to dive into our data was truly a privilege. I have to admit that sharing your data with Kinder can make you feel a little vulnerable, but this process allowed us to learn several key lessons and to develop action steps to refine our programs. The first lessons that we learned revolve around the data dictionary. The data phase of our study brought to light several different changes within our structure and timeline. First, we discovered a major shift in our database structure in 2018. That predated my time here at HAM. We also identified other major events that had an impact on our data service trends. Majority of these revolved around natural disasters. For example, when COVID struck, like many organizations, we were forced to quickly come up with an online platform to directly service our clients. During this time, we also focused our attention on outreach, which accounted for the decrease in unique services being provided at the beginning of 2020, which Sejal highlighted earlier. As a result of the data processing phase with Kinder, we developed a timeline of major events that impacted our database structure and also service delivery. While nonprofit staff may come and go, the data always stays behind. So this timeline will help share these major milestones with those who inherit the system. Secondly, it's really important to not develop data dictionaries in isolation. When you go to implement them, they may not work as you intended. So it's really important to engage different voices in your organization. Whether you're developing a data dictionary for the first time or reviewing it annually, make sure you get feedback from staff as part of your process. For example, I have 2 frontline staff and a very trusted program administrator who provide wonderful feedback for me and also bring to my attention when new services that we provide don't fit into a category we currently have. By engaging these staff members, you also create buy-in from the staff and create a culture of proper documentation. This feedback will inevitably lead to change in your data dictionary. So it's important that when you make these changes to document what, when, and why you changed items. Like the timeline, this will help future reporting and analytics to understand why you may not be getting the results you intended. The second set of lessons is around the database management. Database management can be challenging. We all love data, but how much data is too much? We decided and kind of learned throughout the process that we have a lot of data, which is good. But we also realized some of it was old and it was inactive fields that weren't used anymore. As database managers come and go, so does the style of the database management. So it's important to develop an overarching data culture within the organization that is not limited to one data manager. Second of all, if you do make changes to your system, make sure that they align with your organizational strategic goals. There's a sweet spot of having too much data and having not enough to make sure that you can inform your mission. And too much data makes it cumbersome for your staff. Our mission is to help our neighbors in need and not have case managers inundated with data entry. As part of our CQI process, we're reviewing forms annually to ensure that the data we are collecting is essential to achieving our mission. And lastly, consider developing grant program specific forms that do not weigh down your database. The reality is we all have to report on different programs and grants, but having them in the main section of your database system can weigh it down and cause confusion for staff. We, for example, use Apricot for our database. You can utilize Tier 1 forms to track the main information that you need, and it's the Tier 2 forms where you put this special information that you can build quick and agile reports. Next, we'll talk about data integrity. You often hear the term garbage in, garbage out when it relates to data. It's important to create a positive data culture in your organization. You must connect the why to why you collect all of your data to your staff. Staff need to be able to connect the why and what they do. Otherwise, all the entries can feel like a burden and you may find gaps in your data. One way is to engage the staff in the process when highlighting the importance of the data dictionary. Ensure that the staff is trained and has all the resources that it needs. For example, at every single one of our case management meetings, we have an Apricot training. They may be reviews or they may be sharing new items that we're adding to the database. We collect handouts from all of these trainings to compile a training manual specific to HAM. And have a data team that reviews your data integrity. As Dan pointed out earlier in the presentation, HAM had some gaps in our information, especially in that unknown. We identified a lot of that was coming from our initial online platform after COVID. We were trying to get people in and out and we had gaps in our reporting. So we worked with a consultant who helped us to develop a comprehensive online platform that began to capture that unknown data for us. And then lastly, define your data equation for success. As Tiffany mentioned and Dan echoed in the beginning of the presentation, HAAM is really trying to intentionally move people to self-sufficiency by connecting them to longer-term programs. We want to make sure that it's more of a meaningful and impactful in their lives. As management team and in CQI, we discuss what success looks like when we talk about these, and we defined outcomes. We realize in the data collection and analyzation form that sometimes your data doesn't match up perfectly and align with those outcomes. There can be a disconnect between the outcomes and your data. We had to work through as a team which items we wanted to include as our makeup for success. That's what Dan was highlighting, our assessment things, if we wanted to include those. So be sure that you take the time at the beginning and work through your data as well as while you're defining your outcomes. And now I'm going to pass it back to Tiffany to share some of our key findings and next steps.
Thank you, Kristen. So another key lesson for HAAM is really around questioning the data, which is probably the part of this project that I am most excited about. This is where I really come alive. But what this means for us is putting aside bias. And so we all come to the data table and really to any table with some level of bias. It's just true. But if we are really serious about getting as close, to the truth as we can about what's happening with the people that we're here to serve, then we have to lay aside our biases and really work to figure out what is going on. And I wanted to give you all a real quick example. I talked early in the presentation about our mental health programming. This is programming that we started in 2022. Initially, we were experiencing low enrollment as well as poor follow through on the part of the clients who were actually enrolling. And through looking at the data as well as collecting anecdotal information from clients, we learned that people just were not ready to commit to long-term mental health counseling. Oftentimes, these clients were, especially the ones who are coming, starting in that basic needs area and then moving. If they are experiencing food insecurity or even housing insecurity, they are not always ready to take that first big step in terms of long-term counseling. And so what we did was created a different level of service or an additional level of service, I should say, so that clients could have access to shorter term counseling and coaching services, kind of that crisis intervention level counseling. And immediately we saw an uptick in the number of clients who were enrolling and following through. And so, in terms of bias, we could have easily, made some assumptions about what clients want, what they're committed to. Certainly, I've heard during my career, I've heard bias around people of color not being interested in mental health supports in the way that others are. And so we could have come up with all kinds of reasons that this was happening, but we really had to dig in, lay aside the bias so that we could get to a point where we were really helping the people that we serve. The next thing is engaging the different voices. We have to talk to different people, right? We cannot sit at our around our conference tables as organizational leaders and make all the decisions and draw all of the conclusions. We have to talk to the people that we serve. We have to talk to our staff at different levels of the organization and make sure that we are hearing from everyone. Back in 2023, Kristen and I had a great opportunity to spend some time in Atlanta at Feedback Summit, which is sponsored by Feedback Labs. And we learned a lot here about collecting feedback from different stakeholder groups. And so one of the things that I think she and I agree on, we agree on most things, but one of the things that we agree on is that people, know what's best for them, right? They know what they need. And it's not necessarily our job to determine for people kind of what they need. So we are committed to, and I would even say still learning about how to engage different voices in our work. Developing a list of probable reasons. So why did the data come out the way that it came out? We can tell any story with the data that we see, right? We can make it say whatever it is to say. But again, being honest and having integrity and really seeking to help people, we have to dig really deep and figure out why we got the data that we got. And I jotted down a few notes. One of the Kristen mentioned this when she was speaking about, and so did about this trend that we saw of fewer clients having, I guess, high school diploma or less, I think it was. And so we can make an assumption that the work that we do around education is impacting that. But we don't necessarily know that to be true. So again, it's digging deep and figuring out what that really means. Our online portal that we put into place around the time of COVID, we have had conversations about the possibility that we are creating, unintentionally so, creating barriers for certain populations of our clients. So that could be a reason. It could also be some immigration considerations connected to the reasons that we've seen this. And I would even add disaster to that list. I mean, when in times of disaster, I don't think this would surprise anyone, we usually end up seeing more moderate and even closer to middle income clients asking us for help, right? So does that play a factor at all? We got to drill down on the reasons, and then verifying conclusions with outside data sources. Obviously, we love accessing Understanding Houston, United Way, of course, and all the data that they put out on Alice and other areas of our work. We want to be comparing the conclusions that we are making with what's actually going on around us and in the larger community. And then next steps. We can talk a couple minutes about next steps. One of the things that I'm so grateful about is hearing Kristen say, this is new to us. All this data, there's so much data that the Kinder team provided for us, a lot of it that you're not even seeing here today. And so we have to take some time to really sit with it and let it marinate and figure out what it means for us and what we want to do with it. But our next steps include questioning the data, as I just outlined, also revisiting the data equation for success that Kristen mentioned. So when we look at those two groups, the group 1 and group 2, there were some things that were kind of surprising to us. And so one of the questions we've had is, have we included the right programs and services in the right places, as we measure some of these? So revisiting that data equation and making sure it looks the way we want it to look. And of course, integrating findings into program development, which is, the thing we love CQI, Jessica, and refining the client journey map. And with that, I will turn it over to Jessica.
Thank you so much, Tiffany. I love that call out and like y'all's commitment to continuous quality improvement, that like moment right there. Thank you. And many thanks to the team from Kinder Institute for all your work on the analysis, to Kristen for really diving in and sharing like what they're going to do with this information and how it's going to live within their space and really improve their efforts. So always circling back to that continuous quality improvement. And so I want to lift up a few things that are transferable to other nonprofits. I mean, Kristen had so many like key takeaways that I'm like, that's a sticker right there. That's a coffee mug. Like, if you are an Apricot user, Kristen is a super user. I would have her on speed dial if that was my database. And so I just want to lift up a few things and really call attention to that for other nonprofits to take in and to consider. And so one of the first ones is, and she spoke to it, is this institutional knowledge that folks hold. And how are we documenting that? Like, there is this, like the saying of, oh, if I win the lottery today, who's going to be around to like remember what it is I was doing or what it is we weren't doing? And so really capturing that documentation, but lifting up the importance of creating the timeline for when you made changes, why you made changes, so you can reference those back. And so that has such utility in two ways. One of those ways is, can anybody remember what they did last month? Like, why did we make that change? What happened? What was happening? Like, it is just the speed in which we are working at right now in this current state, that just to be kind to your current memory. But there's also too, the what did we do 10 years ago, 5 years ago? What did it look like right coming out of 2020 that is still somewhat there in a memory for folks, and just taking the time to document that in a timeline so you have that information, and then it can really be helpful as you're looking at your data and really considering the different interpretations of what you're seeing. So that's one big takeaway to take back from this. Another one is, and they were highlighting it a lot, but it's like for the people in the back of the room, for the folks that are multitasking, like data integrity. Like, here is the moment of like, yes, make it easy for yourself, automate that process so you have ways to like check in and make sure you're collecting the information you intend to collect, but also humanize it. And so where spaces where you can have that person check to make sure that you're going back in and looking at it too, to make sure that things are matching up, as just like a way to like really underline that you have accurate data. Because the analysis that they were able to do with HAAM's data was amazing. And it's because HAAM had really quality data. And so I think the way that they were able to do that is because they have these processes in place. They have some automated features, and then they also have this like human check, the double checking that occurs. And so really spending a little time on that, it's that sweat equity that really pays off. Another thing to consider, and Dan mentioned this, and this was something that, it's when you're looking at your data, you do the services, you do the things in the community and in the work, and then it's like taking the moment to see like, but what is this actually that we've done, and how is it being classified? How's it going back into that data dictionary? And so taking a moment there to see, are we classifying things the way that we need to classify them? And I'll often kind of take a moment and say, like, let's take a step back and look at this. And so as we take a step back and look at something, that's where we can see like what is super clear. Yet, yes, that is what that means. Like, food pantry is basic needs. However, when we take a step back and look at things like information and referral, screening, like really what program or what service does that fall under, and like trying to clarify that blurriness that can come up from some services. And so that was the HAAM example that they were lifting up and speaking to. But I got to tell you that they're not alone in that boat. And so looking at your services, seeing what you're doing, what is very clear on paper to everyone involved, and then what are the spaces that are blurry, to really make sense of those. And the last one is, of course, continuous quality improvement, but it doesn't happen alone, and it doesn't happen just with two people or one person. It takes a whole organization. It takes a whole culture of commitment to continuous quality improvement, this commitment to continuously learning and growing as an organization. And so starting small, starting in ways of like, what can we do to just one day, each day, improve our processes, like look at what we're doing and in that vantage point, and tons more resources on continuous quality improvement and ways to really implement that within your organization and the whole umbrella of coffee and quality. But wanting to now kind of open the floor for some questions. So if you have questions that are top of mind for you, please use the chat. Would love to have some questions there, or you can use the raise hand feature, and we're happy to, yield the floor to you to ask your question. And so as those are coming in, I want to pitch a question to Kristen and Tiffany, because it was really amazing to hear like your commitment to continuous quality improvement, even more so in this space. But I'm curious that how you bring staff along into this. And so you spoke to trainings that you do in staff meetings kind of as an ongoing basis. And so curious of like, what other ways are you really cultivating that direct support, buy-in from direct staff for collecting and using data?
Would say, and Tiffany can, chime in, a lot of it has to do with the size of our organization. We have about 24 staff here at Social Services. So a lot of times, yes, we have our formal processes, but we also have informal. I mean, even if it's just going up to the front, talking to people, them giving us feedback, us observing too, so it's kind of an ongoing process for us. We do have those formalized CQI meetings, staff meetings, but also a lot of informal conversations that we have throughout the day with key people in the office.
I love that, because that's kind of that informal note is so critical, because you said something earlier too. You said like they'll bring it to my attention, and I'm like, oh, how do they do that? Is there a form they're submitting? Are they literally like walking down to your office and being like, excuse me, Kristen, I need to show this
It
to
really
you? Like,
is. I mean, I probably have sticky notes too, like sitting on my desk that you can't see, but people bringing it, hey, I can't find this in the data dictionary. This is a new service that we're doing. Where do you want me to put it? It doesn't fall into any categories, because having a social services agency that is so encompassing, we often do find that. So a lot of times it is people just coming down to the office and say, hey, where do you want me to put this? And we can have that conversation.
Yeah, I love that. The saying we say around United Way is closed mouths don't get fed. And so it's like, boy, say something. You see it, say it. Like because we don't know, you don't know, right? And you want that feedback. You want that perspective. Yes. Yeah.
Yeah.
Tiffany, did you have?
I was just going to add that I love that our agency is set up this way, where we have the formal processes as well as the informal. We are a small staff, and so we really do function like a family, with all the, all the happy days and dysfunction that every family has. But if you think about your own home, like I know my kids we don't follow process for feedback. They just tell me what they don't like, what's wrong. And so sometimes it's the same way here, but I think it also just speaks to the level of trust that we have for each other. And it is often those informal processes that that really help cultivate that with our frontline staff.
Thank you. Thank you for sharing those, kind of what it looks like in HAAM and for your organization. I think there's a lot folks can take back into that and see like, well, what could this look like in our organization? Because some do literally need the form. They need the electronic form. And so what works for you, like you do you. We have another question in the chat. I want to go to this one. I'm actually going to toss this one to either Dan or Sajal about this. And this was a curiosity I had as well. So how did you handle the evolving demographics across this research timeline? Clients obtaining education since 2018 or gaining, losing employment? Like, how was that like managing of that aspect of the data analysis?
Sajal, you want to talk to that? You led a lot of that awesome work with RQ1.
Yeah, sure. So the way that the data was set up was that we had client information and then we had service information separately. And so when we have the client's most recent status of employment, education level, etc. So if a client is marked as employed, then regardless of if they got the service in 2018 or in 2024, they would be marked as employed because we were working with their most recent status.
And so we weren't necessarily following the evolution of clients over time, but working with the data that was sort of reflective of what we were getting about that client coming out of the HAM system. And I think part of this is that question of if you're looking to try to track something over time, what are the ways that you're collecting that in that intentional manner so that an earlier measurement that you might have isn't overwritten?
Yeah.
And recognizing, because sometimes you go like, I want the latest and the greatest, and most of the time that works wonderfully. Let's get the latest and the greatest. But if I wanted to sort of talk about that evolution and talk about that change, latest and greatest should be recorded separately from previously.
Thank you. That brings to light for me kind of the importance of the documentation, both like that you have the baseline, then the follow-ups, and then all the subsequent services, but then also knowing that you're not overriding. And so there's that like data documentation. And so I think that was helpful to that person in their question. Great. That also reminds me of when we're thinking of collecting data over time, really curious what the suggestion or advice is from the Kinder team about how do you handle data that is maybe missing or unknown or that's just not captured, like that field wasn't marked required. And so the person was like, nope, don't want to answer that, which is cool. Like, that's fine. Again, you do you don't have to answer that question. But how do you handle that in the analysis?
Yeah, there are a couple of ways. Sejal, I know for some of the sociodemographics, you were addressing that and working with that. So again, I don't know if you wanted to say a little bit about how you were handling that as well.
Yeah, I think there's two big points that I'd want to bring up here. I think one, you should think about how much data is missing. You're working, if you're looking at your data and you notice that 5% of your data doesn't have employment information, I would say that it's enough to just to do your analysis of the remaining 95%. So basically, if it's not that much of an amount of data, it's okay, I think, to exclude it. Another thing that this is a little bit tangential, but what just this made me think of is when you're thinking about data and you want to do some sort of analysis where you're having different categories, it can help to not have too many categories. So for example, if you're working with race and ethnicity, I mean, as we all know, there's so many different ethnic groups in the world. You can have essentially an unlimited number of categories when you break it down, but to do any sort of analysis like this, it's really helpful to have a concentrated set of 4 or 5 that you want to work with. So whether that means lumping groups together, whether that means having umbrella groups, like whatever makes the most sense for your organization and the people you serve. But I think whenever you're thinking about how you're collecting data and thinking about how you're filtering your data, those are just some helpful things to think about.
Yeah, and to build on the 5%, it's very important, definitely checking the amount. Part of it is also who is missing or where that missingness is happening. So, like in statistics world, a rule of thumb is about 10%. If you've got more than 10% of missingness, you've got a problem.
Yeah.
But even if you have less than 10% of missingness, and again, Sado's pointing to a nice rule of thumb, like as the smaller and smaller it gets, the easier it is to sort of say, like, I think we can probably move on, acknowledge the missingness, and let's keep going. A challenge becomes when there's a certain group that's missing. So in statistics, this is oftentimes talked about as like missing at random versus patterns of missingness. And so if your data are missing at random, that's where having 5%, 10%, you don't like it, you don't want it necessarily, you love that complete data, but your results really aren't going to be altered by removing those cases. But when you've got patterns to your missingness, and what I mean by patterns is you might notice earlier we were looking at education. Well, suppose you start cross-tabbing, in other words, like intersecting your variables. And what you notice is you're missing education primarily for older adults. Well, now there's a pattern to that. And so if you just said, well, let's just drop people missing education, what you would be saying was, well, let's just drop older adults as well, kind of. And that wasn't what you were after in the first place. So when you see that pattern to the missingness, that's where those sort of warnings and alarm bells can start going off of, we've got to think about something else to do here. And in the case of the work we did here, we opted to do something else because we wanted to make sure that we kept as many people in as possible. And so we did what we refer to as modeled the missingness, which is to say we just created its own category and treated it as a valid value. Now, that's not to say we gave it a value. We just said, well, we'll just keep you in here and we'll see what you look like. And so that by doing so, that's where you saw for group 3 that was the one group where you had that concentration of education. We brought that to HAM, and HAM was, we had that awesome conversation around, well, what that's reflecting is that those are folks that might be coming to us for that 1-day seminar on the weekend. They're coming to us for that service we're providing over there. We're doing our intake, but we're maybe not grabbing all of them quite the way or getting all of that information. And so it kind of gave this reflective moment of, and as Kristen's mentioned already, like, how are we getting information about who we're serving in that real time and in that way that lets us on the back end make sure we have what we need to be able to know who we're serving as well. Missingness is complex. So a lot there for sure. But again, 10% is a good rule of thumb. If it's missing at random, you're pretty safe. If you do see patterns to your missingness, that's where you're going to want to pause, think about how to handle that missingness. And really, as Kristen's mentioned, how do we address? How do I fix that missingness so we don't keep seeing it?
I'd love to hear Kristen's reaction to that as well, because this is like spot on rules of thumbs around like handling it with the analysis. But what does it look like on the other side too of collecting the data and like setting up some way so we're limiting as much missing as we can, limiting sometimes we don't necessarily want other. We want them to maybe select a box that says it. Some people have strong feelings about other. And so would love to hear your reaction to all this, Kristen.
You know how I feel about other, Jessica. It really depends, and you have to, it's hard to have hard and fast rules when it comes to data. You need to be flexible in relation to your mission. If you have people coming in, like Dan highlighted, for like a job fair, different things, and we have to have them input in the system, are we going to make them sit there and do this complex intake for 20 minutes when that's not the purpose of us or our interaction with them? So it's kind of digging into that. If I would pull an person who had missing data, and I would try to really understand what were they here for, what was their entry point. Hey, and if we keep serving them, I may go down the case manager, say, hey, I see that you have them enrolled, can you spend a few moments to fill in their data? But if it was a one-time thing, I understand that, and I don't want it to be cumbersome to our mission. So it's trying to find a balance there and accepting that.
Yeah. Finding it and accepting it are two very important things. They take a lot of time, but it goes into that act of like, what are we doing? What matters to us for what we're collecting? And then how are we going to use the information? And so love that highlight coming up. We got another question coming in for the chat around the methodology. And it's going to toss that one to the Kinder team around. Did you have to track users from example 2018 who were no longer current in their use of services, or was the research based on the data with the organization?
Yes. So when we and Sage will please hop in here if I'm not quite getting this detail correct. The identification of unique clients was on an annual basis. And so for that reason, we could have the same client there in 2018, 19, and 20. Each of those years, they would have been identified as a unique client. And part of that was acknowledging what we were trying to do was a snapshot, what was going on in 2018, 19, and 2020. Because of that, we were not requiring for that client to still be here. And so if that client's last contact with HAM was 2020, then they were still there, 2019, 18, but then they would have not been considered an ongoing client into 21, 22, and 23. We weren't necessarily looking for an indicator of exit. We really were basing it off of that rich service data that HAM had that allowed for us to be able to identify like who during this year was receiving a service, what that service was, what was the program area there. And so that was our handling for the unique clients. And households followed a similar as well. Sejal, did I get that right? Okay. Sejal helped us with a lot of our sociodemographics and our client identification. And so I just, yeah.
Yeah, I love it. Thank you. Thank you, Dan. Sejal came off on mute. I was like, she's going to add to it, but it's all
Oh,
good.
no, that's pretty much everything.
Okay, awesome. Awesome. So I'm checking the time. No, I could probably spend all day really talking to them about this analysis, what they are using the information for, how it looks for them at HAM. But want to give the last question. Actually, I'm going to use the question from the chat as our last question. We'd love to hear from both groups. Maybe we'll start with the Kinder team and then give HAM the last word on this one. But what was the most surprising finding for you?
Group 3.
Group 3?
Group 3. So when we were sitting down and talking with HAM, we got a wonderfully very clear message, basic needs and then basic needs moving over. And when we got into the data and started unpacking it, and I want to pause here and acknowledge one of my colleagues who worked very deeply with these data, Lee Williams, isn't here with us right now to present today, but I want to acknowledge the role he had in helping unpack these data. So kudos throwing out to Lee there. And so Lee brought this to us. That's part of the reason I bring him up here is he sort of came and he was like, there's a third group. And we were like, what do you mean there's a third group? And he was sort of unpacking and like, well, you've got folks that are coming in and that there's directly into that longer term programming and then navigating and moving through HAM's other different services, but it was starting in that longer term space. And so that was this really cool for us sort of an aha moment, as well as sort of like recognizing that it accomplishes the goal, which is like, how do you help get a person towards independence and self-sufficiency? You're getting them involved in these other things. And so it's doing what HAM's initiative was after and looking to do, and with maybe like a little curveball thrown in, but it was super interesting to see that pull out of the data. And then as we saw earlier, that's really that group that HAM's growing in many, many ways right now. And so it was super interesting. It was a very cool finding. And so that was one of those things where you just go, oh, wow. Like, there are different ways that you're seeing that expansion of engagement with HAM. And so,
I love that as what was like that moment. Because I got to say, just taking a step back for all the case studies we've had, because we've had 3 before HAM. And so each one of them has this like aha moment that comes out that is like, I don't know if it necessarily would have been like exposed without this like analysis, this like conversation of like, let's look at the data, let's go back and forth on it. That was just incredible. And so for me, because that was the similar one I had, knowing what brought HAM to this case study and what they were trying to answer and see evolving for their organization. But Kristen, Tiffany, what was the most surprising for you?
For me, exactly what Dan said was the most surprising. But I think another takeaway that was kind of just a confirmation is even if we are moving people from basic needs to other long-term, there's still that need for those basic needs services and safety net services, and I think Kinder laying out those top requested services by group was hugely helpful for us, as we go through, as Tiffany does grant proposals, as we work in-house on programs, there's that recognition for that barrier removal of rent and food. When you're trying to move them to self-sufficiency, they still need that basic need support.
Yeah, I definitely agree with that. And I say to Kristen and the rest of the team here all the time, it's one of the reasons we're so grateful for the partnership with United Way, because United Way of Greater Houston has been so consistent and I think intentional about recognizing that basic needs is critical to the people that we serve. And we've seen other funders, in our region and beyond, who've kind of pulled back on that piece. And so, so shout out to United Way for for that. I would say in terms of surprises, for me, and I think Kristen and I have talked about this, the fact that we have more in that second group than that first group was a bit of a surprise. Even though we've made efforts to move people that way, I think we were still under the assumption that, you know, the majority of the people that we serve is just about the basic needs. And for years, because I've been at HAAM for a combined total of 9 years, we have a new program director starting with us on Monday, but our last one who just retired, for years, I heard her talking about, we're not just a basic needs organization. We don't just do basic needs. That's not who we are. And so we've been working on kind of changing the face of that, but you don't actually realize that it has happened until you see the numbers.
Yeah.
So that I would point that one out for sure.
Thank you. Yeah, I was like, I want to click back to that slide to show it, because it shows that evolution, and from it going from the group 3, right? From like 3 or 4% to like the 19%. It's like, oh yeah, there it is. There's what Tiffany's articulating, and then also sharing in the data. So wonderful. Well, thank you all so much for your commitment to this case study, for participating in this. Thank you to those who are joining to listen in. As always, your feedback is a gift. And we would love to have it. And so I know we'll put the link in there for the survey to give us your feedback on today. Hope you can join us for an upcoming case study presentation that'll actually be during our August 7th scheduled Coffee and Quality. And then we have another Coffee and Quality coming up on Thursday, November 9th. That one is about trying to make sense of all of your data in one system. And so trying to find that golden record, if you will. So really excited for that presentation, but hope that you'll join us for upcoming ones. We will circulate this presentation, circulate this recording, so you can take into that. I will also put the link for feedback labs that Kristen and Tiffany mentioned. I remember when Kristen came back from that training and that workshop, she was all a buzz in my ear. And so I've been following it, and it's a really neat resource. And so want to share it with everybody if you didn't already Google feedback labs. So thank you again so much for joining us. Thank you to the team from Kinder. Thank you to the team from HAAM. Really grateful for your participation in this case study. Okay, hope y'all all have a great day. Thank you.